I'll go check upstairs if you can.
Yeah, see if it's on.
Oh boy. How are you? I don't know. This is good. And Nori says
Sorry, I don't want to trap anyone in here, but hi.
Welcome everybody. If we could
pull the doors closed, all do our best to start. So, welcome everybody. It's a fairly uncommon event. Topic some time ago. As you know, the legislature and the governor's office have some different responsibilities. And as we approach this session and organize ourselves to engage in oversight and consideration of next steps, we received a request from the governor to address us. And in recognition of just how important healthcare issues are today, Senator Ayer and I were very pleased to take advantage of this and invite the governor. Of the Green Mountain Care Board alphabet. So welcome, Governor.
Thank you. Thank you. Thank you so much. It's great to have you back. And I also want to welcome the new member among you today, Representative Kathy Hoyt. Great to see you here in your new role. I know that Nori served this building with great distinction. As we get about talking about our most important challenge, if I just want to say that when I had the privilege being appointed by the then Speaker Ralph Wright to the Judiciary Committee, where Sally took me by the hand. She struggles with her healthcare challenges. Thank you so much for this opportunity to come by and talk to you about healthcare. As you know, it's been 3 months. Washington Compromise, imposed on the states after a contentious fight in Congress, and a 2-year legal battle that led all the way to the Supreme Court. I don't need to remind most of you of that. When the dust settled, Vermont had 2 choices: implementing the law ourselves with federal money, or hitching our cart to the federal government that's so bound up in gridlock it can barely pass a budget. We chose to take hold of our own fate. It's a good thing we did. Vermont has done better than most states in implementing the Affordable Care Act. Over 50,000 Vermonters have signed up for quality health plans that offer universal benefits, so you don't have to worry about whether you'll have coverage when you get sick and you need it the most. Another 30,000 Vermonters have had their premiums slashed to 0 thanks to the Medicaid expansion. Vermonters will no longer have to worry about losing coverage if they switch jobs or have a pre-existing condition. Their kids will be covered as family members until age 26. That's a big deal for many. And we will be drawing down hundreds of millions of federal dollars to help make coverage more affordable for Vermonters. But like the rest of the country and the federal government, we've had our struggles. I said at the beginning of this process that and is only now beginning to hit its stride. The contract hired to build it have underperformed at every turn. As I've expressed many times since October 1st, no one is more disappointed than I am that we fell short in our rollout of the exchange, and I take responsibility for those failures. We assessed our challenges in October promptly and took steps to ensure that Vermonters' coverage would not be interrupted because of problems with the website. Today, I am moving forward with Commissioner Larson's request to add hands to the task of the day-to-day project management of Vermont Health Connect to ensure that we complete our efforts by March 31st. I'm asking my Secretary of Commerce, Lawrence Miller, who has years of practical project management and business experience, to assist in further improvements in our exchange during the next 3 months. Additionally, I'm authorizing the engagement of an independent third party to conduct a thorough review of Vermont Health Connect's rollout, which will be shared with you and with Vermonters as soon as it is completed. This review will ask how the state can change its approach, staffing, and management structures going forward to improve implementation of future projects to assure success, and what specific lessons can be learned. I know that we have work to do to restore Vermonters' confidence in our ability to get health care right. The confusion, the disappointment, and the struggle created by the website woes have caused some to suggest that perhaps I should be deterred from my promise to move Vermont beyond the exchange to the first sensible, universal, affordable, publicly financed healthcare system in this country. Let me assure you that I am not so easily deterred. The edges of healthcare and our healthcare system. So let me be very clear. I have never been more convinced committed to ushering in America's first universal, affordable, publicly financed healthcare system right here in Vermont.
Excuse me, I'd like to remind you that this is a committee meeting and committee testimony. We ask you to refrain from clapping or any of those things. I hope the governor says a lot of clap-worthy things, but we will be quiet out of respect for the process.
Thank you, Madam Chair. Vermonters know that real health care reform is much more than a website. We also know that it's much more than the Affordable Care Act. Because despite some of the improvements created by the federal law, we still have real fundamental problems in America's healthcare system. It is still a teetering patchwork of payers, providers, and consumers that costs too much for too many and fails to cover everybody. It is still full of skewered incentives that reward volume over good health, and it's still a system no one in their right mind would develop from scratch. And it's still a system that spends money faster than we can earn it. So when Vermonters ask why we should continue to press for healthcare reform after 3 months of frustration implementing a bill that none of us helped to create, my answer to them is a simple one. We cannot afford our current system, and therefore we cannot afford to wait. We can't afford to wait because despite spending twice as much as other developed countries on healthcare, we are no healthier for it. In fact, we're worse off. When you compare healthcare outcomes in the U.S., we lose. Americans die young. in the wrong direction. We can't afford to price they can afford. We can't afford to wait because there's currently nearly zero transparency in the cost of medical procedures. Our hardworking doctors, providers, and hospitals are also subjected to differing reimbursement rates that are often inadequate and unfair. We can't afford to wait because large and small businesses and too many middle-class Vermonters cannot sustain the health insurance premiums that are growing faster than our patients. We can't afford to wait because we spend nearly 20 cents, get this, 20 cents of every dollar we make on health care right here in the state of Vermont. If costs rise at the same rate in the next decade as they did in the past decade, our health care spending will double. Now, I can't believe there's anyone here who believes that that's a recipe for prosperity or job growth in the state of Vermont. We must seize the opportunity we have now to address the fundamental failures of our current healthcare system. And that's why it's never been more urgent that we move forward with a universal, publicly financed healthcare system where everyone has healthcare because they're a resident of the Green Mountain State, not because of all the other factors that determine where your healthcare comes from next. That is the opportunity before us. And as I've made clear, we will not hit send on a new system unless we can assure ourselves that it will be sustainable, bend the cost curve, and help create jobs. I'm convinced that we must do this and that we can do this because we have all the ingredients here in Vermont to get it right, and we've already made some important progress. We've already developed a truly remarkable partnership that would be all but impossible, I believe, in any other state between our providers, our patients, and our businesses to change the way we deliver and pay for health care. We're doing it. The Green Mountain Healthcare Board that you created, now under the able leadership of Al Gobed, is leading this innovation, working with doctors, The board is also focusing on driving down the curve by scrutinizing resources and budgets. They're working together to achieve efficiencies for patients using technology to reduce duplication and waste. Our designated agencies serving our most vulnerable populations are already helping to better integrate the care they provide through the everyday heroic work of people like Tina Hessler, director of the Gating House Group Home in Bennington. We're improving access to primary care in Vermont through the work of people like Joe Wooden, CEO of Gifford Hospital, who demonstrated remarkable vision and tenacity in obtaining for Gifford status as a federal qualified health center for primary care, the 11th in our small state. Hospitals, home health agencies, and other providers have joined Fletcher Allen and Jim Weinstein at Dartmouth. Hospital boards and staff hospital boards and staff statewide have risen to the challenge of tackling costs and rising costs by meeting aggressive budget targets prescribed by the Green Mountain Board. All this is great progress, but it's not enough. In passing Act 48, you wisely recognize that cost containment and regulatory changes alone will not cure the fundamental failures of our broken healthcare system or deliver on the promise of quality, affordable healthcare for all Vermonters. There is more work to be done, and that work will require heavy lifting. Over the course of the session, I ask your committees and the entire legislature to join me in doing four things. First, let's come together and examine the costs and consequences of our current system and recommit ourselves to achieving the first universal publicly financed healthcare system in America. Second, let's educate ourselves and all Vermonters about the ongoing efforts for cost containment and reform to our healthcare system, so it values quality over of care over quantity of care. That's critical, and many folks don't understand that that's the heart of reform. Third, let's discuss why universal coverage is not only the right thing to do, but also the financially smart thing to do, by examining who lacks adequate, affordable coverage now, and how the universal benefits package that meets Vermonters' needs will change all of that. And finally, let's start defining this year. How the current system, and ask these questions. Who is asked to pay where, when, why, and how in the current system? We should look at how regressive and unfair that system is. And we should embark on the path of designing a new system that's built upon equity, fairness, and common sense. I ask your help to look at these crucial issues because I know that Vermonters and our employers will benefit from your hard work. Your scrutiny of the facts, your questions and creativity to help us develop the best healthcare system in America right here in Vermont is going to be vital to our success. We know that there are plenty of critics, both here and elsewhere, lining up to block our progress. Don't fool yourself if you think that's not true. The road ahead won't be for the faint of heart. But I know that we will do right by Vermonters if we all embrace the opportunity we now have to create the best healthcare system in this country. And I know that we can do it because Vermont has a long history of being the first to do the right thing. This is the right thing to do. And this is the right time to do it. It won't be easy, but things worth doing hardly ever are. Vermonters elected us to get tough things done. Let's go to it. Thank you so much for this opportunity to address your committees.
Thank you, Ben.
I'd be happy to take questions, Mr. Chair, if you think that's appropriate.
So I think there's a question here.
To us, says more about Secretary Miller taking this job and what you hope the results of that would be. And the second part is to move forward a little bit and talk about the questions of critics. You know, the way we've rolled out Vermont Health Connect. Why should they trust us to move forward with universal health care?
Sure. First, Commissioner Larson came to me and said, listen, you know that when the legislature comes back, I'm going to be spending some time in the legislature, and frankly, until I was a governor, I didn't appreciate how much time we asked of commissioners and secretaries to spend here. At the same time, we need the nuts and bolts of the operation to continue to hum, because we've got to get our providers, the folks we contract with, finish the rest of He's got all the components from the private sector and his past experience to help us keep the day-to-day functions running and working. So really the plan is to, at Commissioner Larson's request, bring on additional hands to help us get it right. Second part of your question is a good one. And, you know, I really mean it when I say that with all the benefits of the Affordable Care Act, sometimes it's lost on Vermonters and a lot of us that none of us would have designed healthcare reform exactly this way. And I think it's worth mentioning that every time I've spoken with the president, with other governors about this bill, this is what he said. He said, I didn't get everything I wanted in the Affordable Care Act. It was a compromise. What I'm hoping that you will do is take it, make it better, and let the states be the laboratory for really innovative change that we've got to get done. So, I'm not speaking against understand that fundamentally. I think they understand the current system's broken, and I think they want us to fix it.
Representative Ford.
Gentlemen, thank you. Governor, one of the issues of concern that I had as we were developing this bill last year, and it's the reason I voted against it in committee and on the floor, and that was because we created a system based on how many dollars we had to spend, rather than looking at how much would it cost. $30,000 a year. They're out-of-pocket cost. They have now deductibles of $5,000 to $6,000. And I guess my question is the same as it was a week ago. Under your plan, as we move forward, are we going to see a system that's based on quality of care and not necessarily trying to fit it into a certain amount of dollars?
That's exactly what we need to achieve. Let's just remember a couple of things, Representative Poirier. The first is, on the frustration that you had with the Affordable Care Act and tailoring it to Vermont, what Vermont was already doing. Listen, there's no question that Vermont, as you know, was already being more generous than most other states, and then the Affordable Care Act is to some folks that really need health care. So that was our challenge. I think it's worth mentioning that I believe there's only 2 states, Vermont and Massachusetts, who actually are helping to help out low-income Vermonters and Massachusetts beyond what the Affordable Care Act thought was the answer. So we headed in the right direction. I know we didn't get as far as you want to get, but here's my point. I don't think we can nibble around the edges to fix our healthcare system. And frankly, the conversation we're having now is about what nibbling we do around the edges. Let's be honest about this. It's not about spending more money. As I just said, we got to change our thinking a little bit about healthcare in a big way. We sort of have this vision in America that if we just spend more money on healthcare, we're all going to live longer. We're all going to be on this earth longer and have our loved ones here longer. And if only that were true, the problem is it's not. Spending more money is not our challenge. Everybody said that you have health care because you're a Vermonter, not because of where you're lucky enough to work or not lucky enough to work, how rich or poor you might be. And finally, one where we all pay with some sensible system, which we don't have now. And raise your hand if you would.
So I think we have time for 2 more questions. I have Representative Morrissey first.
Governor, thank you for being here. I have a question as to, could you share with us who will be doing the independent review of the exchange? I think that's important for us to see what has caused the bumps in the road. My concern is, though, that we would see the light of day of what the report actually says, being that we never saw the light of day with the UMass review, and also with the complexities that I think they found that we were never able to address within the committee. And then I want a follow-up question after that. So could you share who that will be, and will we be able to
Sure.
actually read the report?
I will have Commissioner Larson bring you up to speed. He's going to speak after Chairman Gobey about the specifics of who we're contracting with and why. And I can assure you that we will share that report with you as soon as we have it, and with Vermont.
Okay, well, my concern is we spent $300,000 on a report that the legislature never was able to see from UMass, so I do not want that to happen again. My other question would be,
I'm a
out
little
of,
confused by that one, but I'll let it go.
no, we never were able to review that report from UMass, and
I
so,
disagree with your assessment, but we will definitely
well,
provide
the
report.
committee did not. Out of the 54,000 that are presently signed up, what is the makeup of that 54,000 people that are on, and what is the impact, being that we were supposed to be, when we started this adventure, we were supposed to be at about 110,000, 120,000 at one point. In the fall, you brought it down to 75. Now we're at 54. What financial and resource impact does this have on the exchange going forward?
Sure. Let me first go to the premise of your numbers. Listen, the numbers that you just outlined don't match my understanding of where we are. Let's be clear. We estimate that there are roughly 100,000 Vermonters who would be eligible, either small business or individuals buying in, for Vermont Healthcare Connect this year. But that doesn't mean that they'd be eligible on January 1st. Only 65,000 of them would be eligible on January 1st. The rest had policies that renewed further into the 2014 year. So, for example, my business in Putney doesn't renew on January 1st. We renew it another day. So my point is, those numbers haven't changed. The number is 65,000 that we think are eligible right now. Commissioner Larson will bring you up to speed on the exact number that we have in, but it's around 55,000. Of the makeup of that group, it's really two groups. One is individuals who are going to the exchange and purchasing plans as was intended. And I believe that that number, I'll let the Commissioner hit the numbers exactly, but we're up in the 20,000s plus on that number. The other number would be businesses that have signed up through either Blue Cross Blue Shield or MVP, which was the option that we made available in October. So I hope that answered your question. In terms
Governor, I think we have one last question, Representative Hands.
Thank you for being here today. We've disagreed in the past, Governor, for example, the House Health Care Committee passed a sugar-sweetened beverage tax last year. And so I was just hoping that you could give us a little bit of indication of the creativity or flexibility that your crew is looking at in terms of financing universal health care.
Sure, and I appreciate the question. Listen, this is where I am in terms of financing, and whether we've disagreed or disagreed or agreed in the past, I want to draw the distinction between what I'm talking about and the conversations we were having last year, regardless of what side you were on. You know that I have strong feelings that our challenge with our existing expenditures and our existing state programs for getting health care permit is to match the needs that we have with the tax revenue that we have. And it's my strong feeling that Vermonters aren't sitting around saying, hey, can you please tax me some more? So when we talk about the budget, and the sugar sweetened tax was in the context of spending money on existing programs, we did disagree. In terms of how we finance this venture, we're not talking about new money. We're not talking about government spending more than we did before. In fact, as I've said, we're going to be talking about spending less on healthcare for better outcomes. And we're talking about moving simply from a healthcare premium, which would go to zero, I would hope, to a publicly financed system. I wish I could find someone that does. And everything is on the table, everything's fair game, and I will be a collaborative partner in those conversations. Promise.
Governor, I want to thank you for your time. I know that other committee members have questions, but I understand that your schedule means you have to move on.
Thank you so much. I deeply appreciate the ability to speak to this joint committee. I know it's unusual, but this important issue is that important tonight.
Next we have Chairman Al Gobey, going to join us at the seat.
Rank has privileges. I'm sure no one's leaving, right?
I think everyone was waiting for you.
They're not?
But why don't I just say, if people are leaving, we're going to try and close the door. And if people are leaving, try and keep it down. I don't know if you're going to sing to us.
The entire staff of Green Mountain Care Board is in the hallway. We're doing a healthcare carol. You'll be joining us briefly. Well, first of all, I'd like to welcome everyone and wish everyone a happy new year. I'd like to welcome both committees back, and I'd like to say thank you to Senator Ayer and Representative Fisher for inviting me to address today. I have some brief remarks, and then I would like to take questions. If anyone has a microphone they'd like to put up here, it'd be great if we could do that. First, the Charles Dickens line, it was the best of times and it was the worst of times, when asked by family and friends today, that I still am. I firmly believe we have the opportunity to build the best healthcare system in our nation. We must partner with providers and engage a vibrant business community to bring systemness to the fragmented healthcare landscape. If we do this well, I believe we can serve the common good. The question for all of us is, can we build this partnership? I would submit today that this partnership exists. It is in its infancy and needs to grow, but it does exist. We must foster the partnership between government and providers to build a system that is built on collaboration. We will build a system that healthcare professionals enjoy working in and patients love. Strengthening our partnerships will require the trust that is built through doing great work together. I stole that line from B. Grouse, if you remember saying. And the fact that Vermont's healthcare costs rose a meager 2.7% in 2012 versus 3.7% nationally are all evidence of the cooperative collaboration we currently enjoy. These first steps are not success. They are small, important steps toward the development of a system that Vermonters will enjoy for decades to come. Partnerships are tough. I think we all know that. The Green Mountain Care Board sees all of you as a partner. We see the providers as partner, we see the business community as partner, and most importantly, we see patients and citizens as partners. Partnerships require a shared vision and willing compromise. Partnerships are threatened by the failure of one party to recognize the intense effort and good work of the other. It is in this spirit that I want to recognize the increased Medicaid funding that you put into last year's budget. It was difficult work for all of you. And in fact, I've heard from some of you that it wasn't exactly the type of thing you could go door to door and crow about. You know, no one really wants to hear that about the 3% Medicaid bump. It's not really, you know, too invigorating to the conversation. I realize it was difficult, and I hope you realize the tremendous impact it had on reform. We still have a long way to go and really tough work ahead. The formation of accountable care organizations, the SIM grant, and Vital's charge to build out our health information exchange are all examples of great opportunities that need to be turned into great deliverables. We must rely on our partners throughout the care continuum to turn these ideas into the system that we all desire. There is not one single thing about healthcare reform that is easy, but I am motivated every single day by the belief that Vermont can lead the nation and build an affordable, accessible, world-class health system. And thank you. I appreciate the opportunity to speak.
Questions?
Thanks. First of all, I appreciate and agree with the stated commitment, continued commitment to moving forward and persevering, particularly through a number of months that were not very easy to endure. In the spirit of moving forward, I want to make sort of a comment and a suggestion, get some thoughts going. As we talk about building this new system that both the governor and you have talked about, we've also talked about building upon sort of some of the existing work that's going on, which is obviously logical. And I would like to suggest that as we move forward and towards the universal single-payer type system, that if possible, we also build upon existing structures that may help us get there. Early on, I think a lot of us had hoped that President Obama, in his great wisdom, would have moved us towards what we thought was Medicare for all. Medicare is an existing program, people trust it, it works, not everybody likes it, but generally it's accepted and it's effective. Instead, we got a pretty convoluted attempt at providing healthcare reform, which we've now experienced through exchanges. I would just mention that I think here in Vermont we have some existing structures that also deserve to be looked at and built upon where we could have built upon Medicare. And to me, the most obvious one is the Vermont State Employees Healthcare Plan. It is a plan that is a large pool of self-insured. It's administered effectively. It works. If anything, there are a lot of Vermonters who wish they had the ability to enroll in the state employees plan, and sometimes state employees actually get aggravation over the fact that their plan is so good. So I guess what I'm suggesting is the possibility of, instead of building something abstract from scratch and saying employees plan, a similar existing structure that's time tested, that we know works, that people have faith in, and can give us a boost our early efforts to expand to include all Vermont.
I agree with you. I agree with what you're saying. What I think is that when you look around the state and you say, you know, we want to build a new system, what does that mean? And when you say that the current system is fragmented, what does that mean? You know, so I tend to break it up into three categories. You know, there's how we collect the money, there's how we pay for goods and services, and then there's how we deliver care. And so in each of those realms, there's great examples of great work and great people and great effort. It's really how they link together. And so perhaps the benefit in the plan you described, and part of the plan, the components that you described are low deductibles, a rich benefit package, it's not financed by the employee, you know, so that's kind of the collection of money piece. My brain goes to how do we then pay for these services throughout the healthcare landscape, and then how do we next make sure that the providers that we have in the state love what we're doing, because if you collect the money in a different way but the providers don't love it, or if you pay for it in a different way and providers don't love it, you've built a system, you've built pieces of the system really well that actually created another problem. So I agree, and we have to inventory what we have, what we can keep, what we need to modify, and how we put it together into a system, not 20 different systems.
Right, and I was just saying, you know, we talk about a large pool of Vermonters that are self-insured, eliminate to some degree the need for insurance companies, have an outside administrator or a state administrator, and I just think that would be a safe plan. It's one that people can relate to and would give us the ability to talk to Vermonters about something that is real, that exists, that works, and that we can use as a model and build upon this. Anyway,
It's a good point. Absolutely.
Senator Lyons. Thank you, and thanks for being here today. I really appreciate it, and all the work that you are doing to bring us all together. I think your conversation about partnership is key. Having ongoing communication is essential. And when you talk about shared vision, I think that we all need to have that conversation. A shared vision about financial investment in healthcare, elimination of the cost shift, and making sure that things are equitable for Vermonters is important. I'm making a comment more than a question, but certainly part of the shared vision is that Vermonters know how to access healthcare effectively without the red tape that we currently see. So as we go forward, it would be extremely helpful to me to hear your
Point, which is that, you know, hopefully during the session, we can do a fantastic job of educating you, catching you up on everything we have been working on. Because accountable care organizations, we discussed a little bit in some of the committees. I also think that there's a gem in what you're saying, which is all about public outreach and transparency. You know, we try to be very transparent as a board. We try to do outreach and let people know what we're doing. It is very difficult because people are busy, and you know, but it is a great point. We have to keep that in mind.
Thank you, Representative Gage.
Yes, under affordability and more people on. I think we have failed on both. First of all, on the financial end of it, we've spent over $100 million on the IT portion of this alone. And at a cost of roughly $16 million this year to run the exchange and $24 million next year, those are significant costs. That's before even a dime is paid in premiums. I called the insurance agents and said, what was paid last year in the state of Vermont as far as premiums to insurance agents on healthcare only related? And they told me $5 million. So $5 million versus $16 million this year alone to run the exchange, plus the $100 million to set it up for literally 620,000 people. The numbers just don't crunch as far as savings, and that's before even a single penny in premiums is paid. I've never known the government to do anything more efficient. That's come through it to help Vermonters have lower cost with more people on it. And as far as more people being on the policies, there's actually less. More people are getting kicked off their policies for from their employers than ever before.
Representative Gage, do you have a
X number of people signed up, and we can't even go online right now and pay for this.
I certainly hear your frustration. I would defer to Mark Larson, who's going to speak after me. He could probably do a better job of answering that question.
But that's not really in your.
No, that's.
Representative Till?
Thank you for being here today.
Thank you.
When I came to the legislature 5 or 6 years ago, Vermont was spending less per capita than the average across the country on healthcare, but we were growing faster than the rest of the country in our expenditures. So it's really encouraging, and I want to congratulate you to see that, you know, last year we were at 2.7%, which is a much lower number than we were seeing a decade or even 5 years ago. And this you have an opinion about what is the sustainable rate of growth in our healthcare spending?
I do. First of all, thank you for the compliment. I'm not willing to take it, and let me explain why. Because I think
It was meant for everybody.
yeah, thank you. So the question that comes to my mind when we start thinking about growth is if a point in our system is $50 million and a point in the hospital budget system is $20 million, you know, so what can we grow at so that we can afford, you know, as I'm a small business owner, as, you know, citizens, how can we afford this? Healthcare has tracked a little bit around 2.5 points over inflation since the 60s. And so the question is, can we get it to be inflation plus, you know, or GDP plus? So if GDP is 2, could we get it to be, you know, 2 plus 1, which would be 3? If we did that in this country, it would solve almost all of our debt problems. If we did that in this state, we would be the best place to start a business and raise a family. You know, so that's why these goals are so lofty, and the numbers are so huge. I mean, when people start throwing around millions of dollars, I'm a small restaurant owner. I literally feel ill in my stomach because it's like, oh my God, you know, what are we doing? But the denominator is so large, you know. So we have over a $5 billion system, and so any movement in it, you know, just, you know, a tiny amount is millions of dollars. And so when I think about a 3% increase in hospitals that we've asked for this year and the next 2 years, you know, that's that number that we came up with, and that's how we did it. And I think that's a reasonable amount.
May I ask the last question now? It's really important as we move forward, as the state of Vermont moves forward to ground truth all of the assumptions that have led us to this place where we think we can get better care, better access at better cost of care for Vermonters. So the House and the Senate are each going to take a separate look at these assumptions and at these facts in our own ways. We may collaborate on resources. The administration will be doing the same thing in its own. How can we be sure? We'd like to know, we'd like to think, I would like to believe that you are a fourth set of eyes on this issue, around truthing the data and looking at trends and so on. How do we differentiate between, how do you differentiate between the information you give us and the information the administration gives us?
That's a great question. So, you know, this speaks to the independence of the Green Mountain Care Board. You know, are we independent of mind, but are we also independent of capacity? You know, do we have the capacity to be independent? And so, we actually have VCures. We actually have a weekly forecasting tool that we're developing. We actually have an analytics contract with VCures to do the type of analysis that Senator Ayers is asking for. And so we actually have better information. We actually have the information in our house that others will need to come to us for that information. It would not be the opposite way where we would go to the administration. So I feel very strongly and very comfortable that our independence is solid and that our analytical capacity is strong to be able to give an independent take on it. I mean, in Act 48, under the Mullen Amendments, it calls for us to do this type of evaluation. And I've been speaking about it anywhere I go so that everyone's aware that we have to be able to evaluate whether or not the system proposed is financially sustainable, does not have a net negative impact on the economy, does not have a negative impact on providers or provider rates. I mean, so we have a big job to do. And we'll be talking about that in terms of budgeting and things we need as we get closer to 2017. But I feel comfortable with where we are now.
being up in the House to continue this conversation this afternoon with Commissioner Larson and rather lunch. Thank you.